on Facebook and I just went live on Instagram. So as soon as okay, it says I am now live.
Oh, there we go. Okay, so now I'm joining you.
Okay, it says I am now live.
Okay, I'm watching you.
Okay, so now I'm joining you.
Request to join, is that what it is?
Okay, it says I am now live. Okay, I'm watching you.
I think I might need to turn my audio down because I can hear myself.
Or if you have headphones, that usually helps with echo too. I'll get mine too.
That might be a good idea.
Okay, going live. I just asked you to be in my video.
Oh, am I? Oh, I'm okay.
Okay, I have to turn off the volume, so I don't know if you can hear me or not. But turn off your volume on the Instagram.
Okay. Oh wait. Shit. This is really complex here.
I think let's do. Hold on.
Like feedback.
Let's end the Instagram and then maybe we'll do them separately.
Okay.
Because I can't get the echo either. Okay, so we are, but we are most definitely on Facebook Live at the moment. So
okay.
Welcome and thank you for anybody that's joining us. Okay, I'm just going to prepare. I don't know where to find it either. I feel so out of touch here. Okay, there it is. Okay, I have found it. So we are live. Thank you for joining us, Tina and Stefanie. So we're here going live, and this is in part of my entrepreneur book club. I decided to start a book club because I actually love to read, but more so to share the knowledge that my business coaches have shared with me onto others and to really narrow down the books that are helping me as an entrepreneur. And also I do like to promote reading because of like our brain health and how important it is. But I understand that right now we're getting an overload of information. And I happen to know a med school student who retains a lot of information on a daily basis. And I thought that she could give us some tips on how to maximize that for us because we're always on the computer. Some of us are reading the ebooks, and some of us are reading, you know, the hardcover books, and some of us are doing audiobooks. But it seems like we're just listening to information all the time, and sometimes we're just tuning it out. And with these tips, I hope that it helps you all, not just like when you're reading these books or when you're part of the book club, but in general, so that we can of course maximize all the information that we're retaining and all the information that we're listening to when we need to, right? So I have my great friend Tina, who is a second year med student, and she's going to introduce herself at this moment. Tina,
Hi. Thank you for having me, Michelle, and for inviting me to this. Sorry, the dog wanted to let us know that he's here too. Like Michelle said, I'm a second year medical student. I attend Burrell College of Osteopathic Medicine. I invited my classmate and really good friend, Stefanie Bennett, who is also a second year med student, to participate because I felt like she has really good insight for, you know, just study skills as well, because she's an excellent student herself. One caveat, I don't personally believe I'm a great student, but I am still here, which is, you know, an accomplishment in itself, I feel like, in many ways. So I guess that means I'm good enough, at least for now. But what I'm about to share is really just information that I've either heard from other students in the past, other sources, about you know, just how to maximize your time. It's as far as medical school goes, a lot of it is about, you know, return on investment, you know, how much time you're putting into it and how much you're able to pull out of it later. Because we are literally given so much information in such a short period of time, and we're expected to be able to retain that, as well as be able to pull it out of our brains at any moment in time, not only for the purpose of doing well in exams, but at the end result, for the purpose of our patients. That's really what this is all about. So I put together a quick little PowerPoint. It's nothing too crazy, but I guess one thing I should also include is we are osteopathic medical students, so you might not be completely familiar with that. Essentially, our curriculum is the same as an MD curriculum. We will become DOs, which is a Doctor of Osteopathic Medicine, when we graduate. We will be qualified to sit for board exams to be surgeons if we want to, psychiatrists, physiatrists. Our colleagues will be MDs. We will essentially be at the same level. The only real difference is we take an additional set of courses where we learn how to use our hands, and we learn to do manual body work as sort of an extra tool set for not only diagnosis, but sometimes we're able to treat conditions of pain or structural dysfunction without having to essentially use drugs right away. So that was one of the things that drew me towards osteopathic medicine, particularly, as well as the fact that it has a holistic approach to healthcare. So without further ado, I will go ahead and share my screen. And let's see, I believe that's that. All right, can you guys see that? All right, cool. All right, so we're going to go ahead and get started. So I'm going to start off with the high yield versus low yield. This is a topic that I think just about every medical student is aware of. We kind of incorporate this. It's whenever we look at a lecture, you're like, what's high yield in the lecture? The long story short is med school is a fire hydrant of information. I kind of put some basic metrics for you to kind of get a picture. Every exam we have, and it's usually once every couple weeks or so, covers about 20 to 25 lectures at a time. And each of those lectures comprises a range from 30 to 90 PowerPoint slides. And just because it has 30 or less than 30 doesn't necessarily mean it's less dense as far as material goes. Sometimes it's even more dense with lower number of PowerPoint slides. So that's not necessarily like an accurate metric of information. But at the end of the day, I mean, 1,300 to 1,400 PowerPoint slides per exam is pretty extensive in itself. And then by the time we sit for our first board exam, which Stefanie and I will be doing this spring, it's a comprehensive exam. It's not only the didactic or the science that we've been learning, it's also the clinical education we've been learning. It's the osteopathic palpatory skills we've been learning. So it's a plethora or cornucopia of information, if you will. So that's kind of where we have to think about, divide and conquer. What is the most important information that we need to learn as it stands today and tomorrow? So that's kind of just an idea to kind of get you to start thinking about it. So when I first started med school, one of the things that I had a huge problem with was not being able to learn everything. I wanted to learn all the things. I was so frustrated that I didn't have enough time to learn all of the things, all of the really cool nitty gritty details about a lot of these subjects. And because there was so much information coming at you, you literally have to triage. You have to decide what is the most important information I can pull out of this today. What is the stuff I'm going to see over and over again? So one of the concepts that we had to come together with was, what is high yield versus low yield? So when you're looking at information for the first time, even, like, you have to ask yourself and be honest with yourself, is this something that I really need to learn as in depth as I would like to? Is this something that is likely to come across my plate multiple times, or is this something that's more of a, oh, that's interesting? You have to think about, what are the things that are relevant to what I want to do down the road. And as far as it goes with instructions or lectures, is this something that was just taught once or discussed as a blurb, or is it something that multiple instructors have mentioned, or is it something that the instructor has mentioned a few times, or has maybe enunciated, or maybe like clued in of, I want you to know this. When the professor says, I want you to know this, that's high yield. If the professor says, this is interesting and I did this as a research project, it's negligible. It's possibly high yield, it may or may not be. And I think that's kind of where I start with, as far as where I go with my study. And the reason why we do that is because it's a lot easier to start broad and then work your way down to the details than it is to start at the details and try to find the big picture. Because when you try to find the big picture after you've been working and trudging through the nitty gritty, it's really hard to kind of get that perspective. At least that's what I've found from my personal experience. And then, if you do want to find that information down the road, it's a lot easier to start big and then go small because you're already getting the bigger picture as it stands. So, Stefanie, I don't know if you have anything to contribute to that at all.
I totally agree with everything you've said. And I have to back up and say that Tina is incredibly modest. She is a fantastic student. She said earlier she tried to downplay herself. Don't listen. She's awesome. But yeah, I totally agree with that. And I think I fell into the same trap you were with when I first started. I wanted to learn all of the things, and all of the things are very nitty gritty details and they're fascinating, but it is really hard to pin them to kind of the overall framework if you don't have the framework in place first. So I totally agree with that. I think having the big picture helps. And then later, as you get more comfortable with the framework, adding the small details becomes a lot easier.
Totally. Awesome. Thank you, Steph. Okay, so just to kind of give you an idea of what we're kind of working with is, this is sort of a bird's eye view of our first board exam. So if you look at all the material that's covered in the textbooks, and I'll be honest, I don't know very many students that actually read the textbooks. Most of us usually go through the PowerPoints, but even then, I mean, it's still much more thorough than what you would see that's covered in the review books, and even much less so what's actually covered in the exams. So this is sort of an idea of like, we're filtering out the things that are really important, the things that are like, okay, what am I more likely to see? And I feel like once you've gotten an idea of that, it's like I said, it's just much easier for you to retain more because you see it at a bird's eye view, more or less. So I'm going to go ahead and move on to the next one. So this is an introduction to the Pomodoro method. I don't know if you guys have heard about it. It's more or less a time management technique. The idea is that you are optimally learning within short spurts of time. If you, like most of us in med school, try to spend the whole day staring at a screen and trying to pull in as much information as you possibly can, literally drinking from that fire hose of information, if you will, there's only so much that you're going to be able to actually retain, because at a certain point, your brain literally tunes out. The nice thing about the Pomodoro method is that it prevents mental fatigue more than anything. So if you're somebody who gets distracted, if you're someone who tends to multitask or has a lot of things going on at home, like, most of us that are living the COVID life, we have home situations that are going to interfere. We have a spouse or children or fur babies, things distract you. And social media is another perfect example of that. And if you need to learn a certain amount of information, or you need to take care of a certain amount of tasks within a limited amount of time, then this is definitely something that you may want to consider. So the idea is that you choose a task, one that you absolutely know you have to do. You dedicate 25 minutes or more, if you can, to that task without any distractions. You turn off your phone, you close your door, you don't let anyone interfere with what you're doing at that very moment. And then once that period of time is up, you give yourself a short break. It could be 3 to 5 minutes. Most people do like 5 to 8 minutes, I think. But the idea is that you're literally giving your brain a rest. And by doing that, you're sort of resetting it and recharging it and giving it that extra little break it needs to keep going. It's not a race, it's a marathon sort of mindset. And there is a lot of data. I did put in a link at the bottom with the source for that, but there's a lot of research going on about how effective it is. And then you actually maximize the amount of information you're able to retain just by doing this technique alone. And I think, Stefanie, you do utilize this more than I think I do, right?
I am an alarm timer person. I do exactly what you're talking about, just modified blocks. So instead of the 25-minute, I've been able to increase up to 45 minutes and then a 15-minute off. So exactly what you're mentioning, just, phone off or away, or, not in my purview. And then 15 minutes of just some sort of break. And if you can get up and walk around, that's great. Maybe throw in a load of laundry in your 15 minutes. Or I like to listen to an audiobook or do something online that's fun as opposed to what I have to do. But I recommend walking away from the screen if you can help it.
Tina, I also, if I can interrupt you for a minute, this technique is also promoted for entrepreneurs. And when I went to the school at Pioneer 21, this is the method that they ask you to start with, for somebody like that's an entrepreneur. Most entrepreneurs, we have short attention spans. So it was hard for me to focus on one task, and they did move us to do this so that you would be more effective at the task that you are doing. And actually, my coach set me up at 20 minutes. So we set the bar a little lower. It still worked. It still became effective. And I have now, like Stefanie, myself, moved up to the 25 minutes. So I'm more productive. Yay.
Oh, that's awesome. Yeah, you can definitely start 20 and work your way up. I kind of started where I tried to do the 20-25, and I get so fixated on finishing my tasks that I've started using my Pomodoro method for Anki, which is a flashcard system that I'll go up and elaborate about more later. But the idea is, in between other rotations that I do, I'll study for a certain period of time on one subject. I'll maybe go over a lecture, and then I'll Pomodoro my Anki time, and then I'll give myself like the breaks in between, and then I'll go back and look at another maybe additional resource, and then just cycle it. And the idea of cycling it is it's keeping things fresh in your head. It's keeping your brain engaged. Because if you're staring at a flashcard screen for a long period of time, after a certain point, you're not remembering what you've been looking at. It's a fact. It just really, I mean, once you get to the exam day, you find that out really hard. but yeah, that's unfortunate truth that most of us have to learn the hard way, and I'm a perfect example of that. So yeah, Pomodoro method is awesome. It's easy. It's something that you don't really have to think too hard to incorporate. So if that's something that you think you could apply, I highly recommend it. The next thing I'm going to talk about is learning styles. So this is sort of a way you kind of have to check in with yourself. There are quizzes you can do online where you can kind of get an idea of what kind of learner you are. It's almost like a personality quiz you can take, like, do you like pictures more? Or do you like singing? And this is kind of a general breakdown of the broad, I guess, the more common learning styles that most people have. And so if you're a visual learner, you tend to respond better to pictures. You can imagine spaces. You can envision an environment really easily. You might do well with graphic art, for instance. You might do well with pictures in general, I guess is the best way to describe it. Auditory, music and sound. Like if you can sing a song and it sticks in your head all day, like you might be an auditory learner. Verbal is something where you kind of incorporate a certain area of your brain that, like, if you talk it out, you remember it better, is sort of the idea behind that. If you enjoy speech and dialogue, if you feel like more engaged, if having a conversation kind of wakens up your attention, then you might be a verbal learner. Physical is more using your proprioception. Proprioception kind of means your body and mind connection, more or less. So if you like to write things out, if you like to draw things, if you like to use your hands and maybe walk around while talking, you're using your body to think, more or less. What there is some evidence that writing things out while you're trying to learn them actually engages a very deep part of your brain that helps kind of sink it in a little bit deeper for you. It's called kinesthetic memory. So there is a lot of a lot of med students that I know use that. And so they'll write on their notes, or they'll write on the PowerPoint slides, or they'll draw, or they'll read, like when we have to read a lot of science articles, they'll jot out like the summary of a paragraph that they just read in order for them to be like, okay, I remember that now, or I get it. You know, paraphrasing is also another part of verbal linguistics that helps. They kind of go coincide a little bit. Logical or mathematical, if you like to reason things out, if you like to think about how things chart in order, if you like to think A plus B equals C, that's really what the logical learner does. They try to reason more than anything. Social is more of you like engaging. It's kind of with the verbal, they kind of relate to each other. And to be honest, most of these really are intermingled. It's more or less just a broad overview of the type of styles. So social is more like by interacting with other people, you feel more engaged in the topic. So, you know, like for the book club, for instance, if you're talking about the book you read, that's considered a social aspect of learning. And then for most of us, at least right now, especially in med school and in solitary confinement, we are solitary learners. If you prefer to work alone, if you don't like the idea of working with a group, if you prefer like your own isolation, just because that's the way you're comfortable, that's totally understandable. And I'm definitely like that as well. So this is kind of just a broad I guess, description of these types of learning styles. So what I'm gonna do is I'm going to go through each of them and just kind of give a couple of tips for each of those learning styles that I've come across that helped me, because I consider myself sort of a hodgepodge of all of these. And I don't know how many people feel like that. Stephanie, do you feel like that too? Okay, cool. Yeah, so Stephanie feels like that
Would
too.
you say that you are like of all these, like which ones are you?
For me, I would say I definitely feel like I'm verbal and logical. I like to talk to myself sometimes, where I'll ask
Okay.
myself questions and then respond to myself like a crazy person, but it does work. And with med school, especially with logic, I feel like that helps me because I'm able to see things in a pattern more effectively. And a lot of professors have said in the past, like if you're able to understand how it works, you don't have to memorize as much. So that's kind of, those are the two that really work with me. And visual spatial, like there's a device you can use to incorporate visual spatial. And when I'm truly desperate, sometimes I'll use that as a backup system. But how about you, Steph? Do you have a particular style?
I really love that you listed these out because I've never seen a comprehensive list of this before, and I'm a little bit of almost everything. I think if I could figure out how to incorporate 90s lyrics somehow, I would be musical as well, but I can't figure that out in my studies yet, because I can for some reason remember those lyrics like decades later, but I can't remember some of my flashcards. But yeah, I'm probably a little bit of each of these, and I find that depending upon which subject I'm trying to learn, sometimes I rely more heavily on one versus the other. So for example, auditory was a lot more important to me when we were doing our cardiac block, because I needed to hear the sounds that the heart was making before I could really understand where they were coming from. So I think being fluid in all of these is really good too.
That's a really good point. That's definitely something that I had to learn too, is being flexible in my learning style, because like you said, like depending on the block, something works out better than the other. Like for me, renal helped with, or not renal, well, logic helped with renal would be a better way to say it, because there were so many pathways. And I felt like if I understood the way that things coincided or worked as a chain reaction, it helped me sort of see like, okay, if I don't do this, then it's not going to work out that way, you know? So yeah, perfect. Like example with cardio too, like I had to hear the beats and I would make a song with murmurs or stenosis, which is it means valves are blocked. So I would make a song in my head and be like, oh, a swishing back, you know, like, so little things like that. It definitely, for sure, you have to kind of be flexible with which style you're going to incorporate. And the important thing is that you're willing
Is
to
there
try.
one that you would say, maybe let's say even prior to med school, that you're not good at?
That's a really good question. One that I'm really not good at, I would say, is, oh gosh, probably solitary. I mean, as much as I do like studying alone, it is hard. So I do realize that, you know, after we had to leave campus when COVID came around, it was a lot harder for me to engage my brain without having someone to talk to about it. And I think that was a very essential part of the med school experience that unfortunately the first year students that have been exclusively on their own don't get to appreciate just yet. And I hope that they're able to next year, like truly. But yeah, that was definitely an adjustment, was having to get used to just completely on my own studying and understanding concepts without any outside input.
That's so interesting. I would say for me, it's the auditory. Like I cannot, if I listen to it, it just, I cannot focus. I cannot pay attention. I don't learn it as well as when I see it like in writing. I have like a shorter attention span. I don't know if it's because it's my eyes that like help me learn better than my ears. So that has always helped me understand things better, like to look at them and to see things in writing. That helps me when I need to learn something.
It's really funny you say that, because for me, reading something through is really hard for me to retain information. And that's one of the reasons why I have to jot little quips after I read articles, so that I'm able to synopsis like the information that I'm being given. Because, you know, after a couple of paragraphs, it just kind of, my eyes glaze over, and I'll read the same paragraph multiple times, be like, what the heck did I just read? And so it's kind of interesting that you're able to do that. And I kind of envy that, because I wish I had that skill. How about you, Steph? Is there one that you do not relate to at all?
Ah, that's hard. My husband would probably agree that I could get lost in a wet paper bag. So visual for me is like, I guess spatial specifically, because sometimes I can doodle and that helps me remember my doodle. But if I have to picture something in three-dimensional space, I'm gone. So I would say that's probably one of my weaknesses there.
I totally appreciate that. Okay, so I'm going to go ahead and move on. So this is sort of a visual representation of all the learning styles. And, you know, we are all different, and we all have our strengths, as I'm sure you can kind of gauge now. So if you wanted to do a self-assessment, I posted this link down here, but you can literally Google "what's my learning style," and you'll be able to find 5 or 6 different quizzes to do really quickly if you're curious. And I highly recommend it, because I think that helped me a lot for my first year, especially. Okay, so for visual learners, a few of the tips I thought about was using color layouts, spatial organization to make your associations. And the key really is making your associations. One of the things I like to do is make mind maps or diagrams, especially when it comes to processes, or case in point, we had to learn a multitude of different types of tumors for this block. We're doing neurology. So I tried to write down all of the different types of tumors and what they all look like. And with the last block, I literally made a map of all the different tumors that were related to that particular block. And I was able to see the pictures of how they look on pathology side by side. And by gauging sort of like the stepwise pattern, I was able to sort of ingrain that a little bit more deeply. When I do look at resources, so a lot of times with your second year, you tend to look at outside resources more heavily than you would your first year. So we have this book called First Aid, where we go through it, and we're literally looking for the high yield before we look at our actual lecture, which is very helpful. We're very lucky in that. But what I do is I have special highlighter colors that I use. So for yellow, I use that to define the disease. So when I'm looking for something, I see yellow, I'm like, okay, that's what the definition is of that. For pink, I put risk factors or things that cause the pathology to develop. For blue, I put complications. So like, if you have this disease and nobody treats it, what's the worst thing that could happen? So I highlight that in blue. And then for green, like if you were able to treat it with surgery, if you're able to treat it with drugs, what are the possible tools that we have to treat that illness? And then orange I use as a way of how do you see it? You know, how would that person look if I saw them in the clinic? So that way it sort of separates a big topic into chunkable, digestible pieces. And I feel like color coding is kind of the main idea as far as like for me with visual learning. Steph, do you use this at all?
I don't use the highlight colors, but I was just thinking this is such a fantastic idea. I have done similar things though with kind of doodles in certain colors if I wanted to remember a particular pathology or something of that nature, but this is so beautifully consistent. So I would recommend taking Tina's advice on this one.
You're too kind, thank you. Okay, so I'm gonna move on. So social learners, this is for people who like to talk, you know, you like to engage other people, you like to hash it out. Whiteboards are an excellent tool for people that are social learners. One thing that I have learned from trying to work with groups in the past is less than 5 people is ideal because at least for me, when you get more cooks in the kitchen, it's really hard to sift through the chaos and it's a lot easier to be social rather than be productive. So, you know, if the goal is to be productive and to collaborate all the information that you guys know together, less is sometimes more, but not too less, if that makes any sense. So I feel like my golden group is usually 3 or less, maybe 4 every now and then, but for the most part, if you have 3 people, everybody has something to contribute and there aren't too many opinions that might be differing and you don't end up confusing yourself more, because that is something that can definitely happen when you have multiple people collaborating at the same time. One of the things that I did a few times with classmates is we would tackle a very complex topic like immunology, where you have all kinds of different proteins that you're dealing with, all types of different reactions that are going on. And we would literally work together to draw it all out or write it all out on a board and make sure that we all had contributed something that was like helpful to that topic. And then we would take turns memorizing what was on the board as much as we possibly could. And then you would turn around and see like, okay, what did I forget? Okay, I'm going to turn around and remember and say everything over again. And then like, okay, I remember now. Okay, your turn. And so the next person does the exact same thing. And once everybody's gone around and being like, okay, we all know the things, wipe off the board. Okay, next topic. I feel like that's helpful because it's collaborative. It's nice because you're able to engage your mind in a way that's fun. It makes learning a much more comfortable experience, so to speak. Stefanie has a fabulous whiteboard in her apartment, and I'm always impressed by her skills. So I'm sure she incorporates this. How about do you do that, Stefanie, a lot?
I used to use the whiteboard a lot more than I do now, but that's because I have a Surface, which is essentially a whiteboard in my lap. So I've been doing that a lot more. But when I first started using this technique that Tina's talking about, I did do a lot of whiteboards with a lot of different colors and colorful pictures, because then I found I could remember my sketch or had like a visualization of the board in my mind. And now I do it all on OneNote, but it's the same concept.
And then Steph shares her amazing notes sometimes with us, and it's so valuable. That's another aspect of social learning is collaboration. You know, if I'll take all my notes that I think are important, Stefanie will take all her notes that she thinks important, other classmates will do the same. And we're very inclined to share our notes with each other because without a shadow of a doubt, somebody caught something that we all missed. It's almost always possible. And it'll be that one test question that shows up almost all the time. And in fact, I mean, it's just like Murphy's Law. It's going to happen if you thought that was low yield. So it's very valuable to have people collaborate when you have that potential to do that. Okay, so this is sort of I guess I could have gone back, but this is essentially what I was describing with social learners. One of the things I like to do is teach my wife when she doesn't really want to learn. And the thing is by doing that, I'm essentially reprogramming my mind to be able to paraphrase information. And by paraphrasing, you're actually creating more neuron connections. You're actually creating more synapses in your brain, because you're forcing yourself to think about a very tough subject in another way. And one of the things that's so great about doing that is teaching is just as valuable as it is to the teacher as it is for the student, because sure, the student's getting that information, but the teacher is hardwiring that information in a different way that's going to make it stick even harder. So in some ways, teaching is the last level of learning that we've been taught in a lot of ways as well. Stefanie, you laughed really hard. Do you do the same thing with your husband?
I do. Yes. My husband has learned a lot of things that he probably had no interest in learning. I just love the way you phrase that because it's so true. But she's absolutely right. It's really interesting because you can talk yourself into, I understand this concept in your brain. And then when you try to explain it to someone else, like my poor unsuspecting husband as he's trying to make his lunch or something, I noticed that I'm midway through my explanation and I realize, oh my God, I don't actually understand this next part, or I can't explain this next part. And then I know exactly where the holes are in my understanding. So it is a really helpful practice to get into if you can find a person, an unsuspecting person that doesn't mind listening.
That's a really good point too, like finding the gaps. I think you're absolutely right. Like by explaining things and you hit that wall, you're like, oh, where do I go from here? I better go find that and reiterate it. And then you'll go back and harass them again. And you're like, okay, now I can finish the story. It's an excellent tool to be able, like, if you really want to know something through and through, I highly recommend being able to do that if you can. So here's some of the benefits. You definitely can identify things that you missed out on your individual study by interacting with our students, particularly people that have covered the same material that you have. One of the things that a lot of us do before an exam is we'll go through the high yield, we'll list out all of the objectives we were supposed to learn or all of the diseases we're supposed to cover for the exam. And then we'll be like, okay, well, what do you know about this? Okay, now I'm going to tell you what I know about it. Well, here's something that I caught that I think is really important. What do you think about that? And I mean, there were so many problems that I got right just because of this alone, just from like pop quizzing each other, essentially, like asking, okay, tell me about this. Tell me about that. What do you think about this? Okay, here's what I know about that. It's a nice way to not only engage your mind, but you're literally thinking on the fly. And in med school, that's something we have to start practicing because once we start rotations, it's going to be our daily life. So we're sort of preemptively preparing for it right now by doing that. but yeah, it's a very beneficial tactic if you're able to do it. So for physical learners, this is really more about tactile motion. Like Stefanie uses the whiteboard or her pad to draw things out. Flashcards are also really helpful. Handwritten notes. In undergrad, I would actually handwrite my flashcards, and I rarely actually went back to look at my flashcards, but the act of writing out the flashcards was really helpful in itself. Writing out, like I was writing out research articles, I would write little summaries or 2 sentences that summarize the whole paragraph. That sort of ingrains the high yield, so to speak, of the material, and you're also ingraining it in your physical memory as well. So it's interesting how it really taps into a deep part of your brain, the basal ganglia, and it connects to your cerebellum, and you're literally like, you're using multiple parts of your brain to make a memory, which is really fascinating if you think about it. And it's kind of nice that we're in neuroblock, so I'm really familiar with this topic right now. But one of the things I like to do is I'll walk around and talk to myself. And I feel like when I'm walking around and I'll step and be like, okay, this does this, and then this does that, and then this is why that doesn't work, and this is why, the act of just moving around, engaging your body while you're thinking, I feel like in many ways has helped me sort of land a concept a little bit better. So let's see. Oh, I guess I should ask. Stefanie, do you feel anything you want to contribute to that at all?
I don't do as much of the physical because I'm apparently just a couch body. But I I do sometimes write with my flashcards. So I'll have my flashcards up on half of my computer screen. And since the other half of my screen can be OneNote at the same time, I'll write the answer or say the answer instead of just flipping to the next card. And sometimes I'll remember during the exam writing out the answer, and I'll remember my handwriting, which is really helpful. And on the previous slide, Tina has saved my bacon many times with last minute quizzing questions. So I highly recommend that if you have a friend who is willing to study with you. Tina has definitely illuminated many answers for me just because she picked up on something that I didn't. And I am eternally grateful for that.
And
Tina,
that
also
definitely,
in business coaching, they do teach you to write everything down. I feel that with my to-do list. Sorry, this was with the physical. Handwritten notes, when I write down what I need to do, it's more likely that I'll get it done than if I don't. I don't remember unless I write it down. So strange.
yeah, I mean, case in point, it's really fascinating. So I mean, not only is it anecdotal, it's there is a lot of research behind it as well. So that's science. Just I love science. Okay, so we'll go on to the next. So aural learners, these are this is kind of where you like to make rhymes, maybe limericks using music. There's this technique called memory palaces where I don't know if anyone's familiar, it's using this technique called method of loci, which you're basically creating an imaginary place. And this is something that I like to do, especially when I'm really desperate to understand a lot of information or retain a lot of information in a very short period of time. So you essentially create an imaginary place. It's easier if it's somewhere you've already been, but you know, you can easily make up any place. And you're putting in objects as you're walking or as you're going through this imaginary location, and you have an object that symbolizes something. And as you're walking through, you remember the order of the pathway by remembering the objects that you come across as you're passing along that imaginary encounter. So I made one to kind of illustrate this myself. So this is one I made last year to remember the arteries of the leg. So the idea is that, I mean, if you want to close your eyes, you're totally welcome to. But the idea is there was this house that you came to, and the front door had two big circles on it. And when you walked through the door, there was a female gendered person. And then she was holding a can of soda pop down by her knee. And the soda pop was tilted forward. And there was a horse or horses printed on the tops of her shoes. And then there was a beer, a Peroni beer on a table behind her. And then on the floor beneath her feet, there was a plant. There were plants painted on the ground. And so what it was is the two circles represented the medial and lateral circumflex arteries, which are up here over by your hip, and they go around your femur bone right up here. And then the female gendered is the femoral and the genicular, which it goes down to over here where it crosses over behind the knee, the thigh. And the soda pop is the popliteal, where it's right behind your knee. And I had it holding by the knee so you can remember the popliteal is by the knee. The tibialis anterior, tipped anterior, so tipped forward. It runs down the front of your leg. And then there was a poster tipped over behind her. So a posterior tibialis artery was behind her knee or behind her leg. The horses, or dorsalis pedis, which is actually an artery that runs over the top of your foot. And then the plantar arteries were at the bottom of the foot. So the plant was painted below her feet. So the bottom of her feet where the plantar arteries was touching the plants on the ground. I'll be honest, that was like the most impressive one I've ever made, and I'm really proud of it, but like I haven't really made many besides that. I've kind of relied on other sources for my devices, but this is essentially the gist of it is you can literally make up any sort of imaginary place. You can put whatever you want. If it makes sense to you, then it works. If it sticks, then it's perfect. So you don't really need it to make it doesn't have to sound like the word you're trying to remember, like horses and dorsalis. I mean, they don't really sound that similar, but it was just enough for me to be like, okay, I remember that horse's dorsalis, top of my foot, got it. So that was that one's a really cool like technique, and it takes practice. I'll be honest, it's not something you're gonna, the first time you try it, it's gonna be really easy. It's going to get easier as you do it more, but supposedly if you do it yourself, it ingrains it, or it codes it into your brain much better than if you were to rely on somebody else's device or memory device. Stefanie, have you ever tried one of these on your own, or do you use this at all?
I'm wishing I had this for that exam. This is awesome. Again, the spatial kind of trips me up a lot, but I do use a service that does this for me, which is called Sketchy Medical. Anybody that's in the medical field knows Sketchy. So it's a very similar thing. They kind of tell you a story and there's a cartoon associated, and lots of times I can remember the cartoon and it helps jog my memory. But I have not written something so beautiful as this. This is really good.
Oh, thanks, Steph. How about you, Michelle? Have you ever heard of the method of loci before?
Okay, no, I have not, but this seemed like so interesting, such an interesting way to remember it. I actually did close my eyes and picture everything, and when I opened them, I saw like the notes that you had on the right-hand side, and it was very interesting. I was like, oh, this is so cool. That's a very neat way to remember this information. I love it.
I'm glad you like it. And Stefanie mentioned Sketchy, and it's funny that you mentioned that because I did include a slide to kind of illustrate what Sketchy is. So Sketchy is a service that we use, most of us use as med students. There are other services out there like Picmonic, but the idea is they tell a story and they draw a cartoon picture, and each of the symbols represents another thing to remember. So I used Group B strep because it's like one of the smaller ones available. So I figured it was the safest one to put out here. So the idea is that everything about this picture represents something. So the purple is because it stains a purple color when you do a special stain on it. And that's usually how we categorize bacteria, is what color does it turn when you stain it this certain way. And that's called a gram technique. So it stains gram positive, and positive is purple when you stain it. There's a little baby here because Group B strep causes neonatal meningitis. And that's what the helmet represents, because the helmet is a swollen head. So you picture the baby with a swollen head, you're like, okay, neonatal meningitis. You think about there's certain tests that you run for the bacteria. So this symbolizes beta hemolysis. So that's the name of the finding for that bacteria. So it's kind of cool because it's something that's already prepared for us, and we're very fortunate to have that. But there are different devices like this for other industries, so to speak. I think because there's such a huge market for medical students, we have a very extensive library of resources at our disposal. But this is sort of like the oral concept, is you're able to picture it. And like Stefanie said, for me also, is sometimes I'll be like, I can't remember exactly what it was, but I remember what the picture looked like. And that's been the difference between a right and a wrong answer so many times, especially when it comes to microbiology, because it's not my strongest suit. But yeah, so this is a really cool technique for oral learners. And then for verbal learners, this is something where, we're writing and talking and using language really helps you ingrain ideas. So this is where mnemonics really come in. The one that I put in here is the bones for your wrist. So all these little tiny bones that go in here, and in the order, this is the mnemonic that almost everybody uses, and it's called "Some lovers try positions that they can't handle." And each letter represents another bone. And it actually goes in the order of the row. So scaphoid, lunate, triquetral. I'm not going to name all of them, but essentially, if you can remember the phrase or the turn of phrase, sometimes you're able to remember the bone. And then, for this one particularly, there was an exam I remember where I couldn't remember which side of the wrist that particular bone was located. And I wrote out you know, some lovers try all positions that they can't handle, but I just wrote the letters. And by writing all the letters and I remembered which order the letters went in, I was like, okay, so that's the bone that's on this side of the hand. So now I can remember what the answer is for the test. And that's really kind of, it taps into a nice little memory loop, more or less. The other cool thing about verbal learning is I put it in here, by talking it out and communicating it with somebody else, and it sort of coincides with the whole social learning aspect of things. You're tapping into these two areas of your brain called Wernicke and Broca, and these two areas are responsible for language. One is responsible for your ability to speak, and the other one is responsible for your ability to understand what's being said to you. And so when you're able to talk to somebody and hear it back, or if you're able to listen to something really well, you're actually using this resource. And one of the things that I would do on my way to school, actually, because I drive to Las Cruces from El Paso when I go to school, is I would play audio lecture, like an audio lecture service, and I would pause the video and I would recite what the video told me. And then I would play the video back and I'd be like, okay, what did I miss about what that video said or that excerpt? And then, you know, I would move on forward if I was able to respond or reply the exact same thing that I heard. And by doing that, you're using both of those regions, and you're also using the region that connects those two spots in your brain. And so it's really just hardwiring it in multiple ways. And I mentioned how down here I paraphrase after 2 to 3 passes. And one thing I forgot to mention was the number of passes is sometimes helpful. So if you see something once, the likelihood of you remembering it is probably very slim to none. But if you say it 2 or 3 times over a span of time, you're more likely to remember it much longer. And I'll kind of talk about that later when I go over spaced repetition, but the number of passes is really helpful to keep in mind as well. And so for solitary learners, this is really something that I've had to learn very hard is you've got a plan. If you're learning on your own, you've got to have a plan of attack, because otherwise you're literally flying blind and you don't know where you're going. So one of the things that I like to do is I'll make a list of everything I need to do, all the objectives I need to do, or the lectures I need to cover, or I'll list all the lectures that I need to see, and then I'll list all of the outside resources that correlate to those lectures, so that way I kind of have an idea of what I've tackled. I don't know if I can show you, but I guess I won't. But the idea is you got to keep a log or keep a plan. Otherwise you'll get lost in the mess and you won't know how many times you've made a pass or how many times you've actually seen something by the time you're actually required to recall that information. Stephanie's really good about this. She's very, very organized. So Steph, do you have anything to contribute to that?
I wouldn't say organized. It's just more of a necessity. I have the memory of a goldfish, so I really need to see it many, many times before it sticks. So generally, I do exactly what Tina's saying. I have a list. I follow the list. So whenever we start a block, she mentioned earlier, we have about 2 weeks of lectures before we have an exam, depending upon the block. Sometimes it's once a week. And so beginning right on that first day, I have lists for every day leading up to the test, what I need to cover each day. And I do not go to bed until the list is done, which means sometimes I'm up pretty late, but it does require me to write out all of the benchmarks that I need to reach each day. And I know that I achieve them as I tick them off. And then the next day I start new with my new list. So yeah, I'm a big list person. I highly recommend trying that out.
So both of us agree. Lists are great, especially when you're learning on your own. How about you, Michelle? Do you go by lists as an entrepreneur?
Oh yes, I cannot live without lists. So I actually have a chalkboard in my bedroom, and the chalkboard tells me what I need to do for like each one of like my businesses and some organizations that I help run. It gives me like a to-do list of 3 tasks that need to be done. And so it reminds me, like, it's a list of like the things that need to get done. So I get to cross it out. But I don't know what I would do without a list. Like, I definitely write everything down.
I'm right there with you. If I don't write it down, I don't know if I did it or not. and I get really anxious. That's also the other thing that's helpful, is it gives you a peace of mind that you covered it and you can move on to the next task at hand. So the next thing is about logical learners. So this is about, you know, painting the whole picture or being able to tell a story. We have this really amazing professor of immunology at Burrell, Dr. Zalai, and one of his major take-home messages is tell the story. Remember how to tell the story. If you can tell the story, then you are successful at knowing the concept. And that's always been sort of a take home for me. And I try to take that to heart with a lot of things. I could do it more, but it's a great lesson. More than anything is be able to tell the story. If you can break it up into little pieces and be like, this goes to this, goes to this, goes to this, you're able to see, okay, if I were to pull this part up, what would happen then? How would it break? So one of the things I'll do is I'll picture the whole pathway, or I'll picture the sequence of events, and I'll mentally break it. And I'll think, okay, if this enzyme didn't work, what would happen? What would be backed up? Where would it get shunted? What enzymes would be lacking if this happened? Or, you know, it's a way, especially for medicine, for us to be able to think of outside of the box and picture a concept abstractly, more or less, because by the time you're able to, or you're required to be like, okay, well, what would happen if this happened? You're able to say, oh, well, that would happen, or, oh, okay, well, we can't do it that way because, or this doesn't make sense because of that reason, and because I logicked it out in my head. And it's kind of a nice way to be able to consider a topic. But one caveat I will have to vehemently express is you can go down a rabbit hole with this tactic. It's really easy to spend so much time understanding the story that you forget the rest of the stories you're supposed to learn. It's really easy to do that, especially if you have a lot of stories on your bank of lists to memorize. So I guess I would advise proceed with caution. And if you really, you know, if you're struggling with a certain concept, this is a really good tool, but I don't know if I would use it for everything. I would use it very sparingly. For sure. One of the benefits, or I'll list the benefits, is it does help with the big picture. It really helps you sort of understand how something works. And by knowing how it works from the bigger picture, it's a lot easier for you to remember everything without having to memorize so many things. So you're really seeing it from a bird's eye view, but you're not necessarily having to memorize all of the little nitty-gritty details. So this is sort of incorporating that high yield mentality to be able to say, like, okay, what's the big picture here? And also you click more, you know, your head makes the connections more. You're able to go, aha, and that's so satisfying, like so profoundly satisfying when you're able to say, I know this because of that, and I know this does this because of that reason. And Stefanie, I'm sure you totally relate to that.
Yeah, I was just going to say, for the people that are listening on the business end of things, this is a great tool for figuring out distributions, chains, things like that, because you're basically asking yourself, how does the organization work as a whole? What happens if this particular part doesn't function the way it's supposed to function? How can I fix that? How can I identify that's where the problem is? So you're kind of playing this mental Jenga game, like Tina was talking about, where you're pulling out blocks one at a time. What happens to my business when this fails? Or what happens to my business, you know, when I add this? Does this help streamline? And you're kind of asking yourself, you're walking yourself through the process, and you're also identifying weaknesses as well.
That's a really good point.
I actually do feel this has happened with actually the soaps. When we make, you have your basic recipe, but what happens if it cools down too fast? What happens if it starts clumping? What happens, you know, if it's not mixing well? And so you know how to fix everything. So, you know, you're right. You basically recognize the pattern better because you understand how it works, and it makes it even easier for like the the employees that are helping out, like in doing that task. So I can definitely relate to this in the business aspect.
That's an awesome example. Thanks, Michelle, for contributing that. I didn't even think about that. Okay, so this part I'm going to talk about spaced repetition. It kind of goes back into the multiple passes thing I mentioned. So there is a growing body of evidence to suggest that if you look at something just once, the amount of time you'll remember it is finite. You're not going to remember it forever. But the likelihood of you remembering it for a longer duration of time vastly improves if you revisit it in a certain period of time. So one of the ideas is you look at it every few minutes the first day, you look at it every few days the next time, then you look at it every few weeks the next time, and so on. And that way it actually stays fresh in your mind, and it's recoding and recoding and recoding, and eventually it becomes coded into your long-term memory. And that's really the end of the goal, right? Like, we want the long-term memory, because otherwise you're just, remembering what happened today and you forget it when you wake up the next morning, because that's what we do. It's like, it's natural. But if you're able to do the spaced repetition, the recoding process is creating the long-term memory that you need. So that's something that I think every medical student I know uses. We often say, how many times did you make a pass at this lecture? Oh, I made it 3 passes. Oh, you did 4 passes? That's amazing. I wish I could do that. I wish I had that time. I'm lucky if I can get to 3. Usually my goal is to see it twice, or if I can, see it through the lecture and then see like 2 resources, and then if I have time, see the flashcards that I've made by the time my exam comes. But there are a lot of resources out there to kind of help you do that. So this is sort of an illustration of what spaced repetition does. So the slope here is the amount of time that you're able to retain it. So on average, when somebody sees it for the first time, they'll usually forget it by the 3rd day afterward if they haven't looked at it again. But if you were to look at it again the very next day, notice how the slope is much longer, and you are able to expand it to an additional 6 days. And the more you're able to do that, the more you're spreading out that information, the flatter that slope becomes, and the more likely you are to remember it by day 10, by day 15, by day 20. So the idea is essentially seeing it, having that pass, the multiple passes is really the goal of that. So there are some resources. Anki is a free flashcard service that you can use. You can use it on your phone if you wanted to pay the fee, but you could also use it on your computer. And the nice thing I like about Anki and Quizlet's free as well, is that you can customize your flashcards. You can type it all out. You can put GIFs or GIFs or JPEGs. You can put images, and you can put audio files even. There's a flashcard deck that I use for heart sounds, specifically, where you'll hear a murmur and like, what is that sound? Oh, it's regurg. So it's a nice way to be able to see that information multiple times, hear that information, retain that information. And the Anki particularly uses a really cool algorithm. Like, they're literally designed for spaced repetition. And I'll show you kind of an idea of what it looks like. So this is a sample of an Anki flashcard. This is one of my cards from this block, actually. But the cool style about these is you can customize, and there's a lot of room for coding. So if you're a coder, then this is like golden for you, because a lot of it is you literally like type it all in the background, and you're able to customize it. And so this particular card type I utilize with this other service called Amboss. And so this underlying green line, what it does is if you float it, your mouse over it, it'll actually pull up the definition of that word. And when you hit the space bar, this gap in the sentence pops up, and you're able to say, okay, this is the drug that deals with this particular issue. And if you forget what the drug does, you can hover over that word, and then it shows you, okay, this is the definition of the drug, this is how it works, these are the reactions you get if you don't, or this is the bad stuff that happens if you have too much of this drug, or if you're allergic to this drug. And then it's kind of cool, there's other windows where you can put other images into these other areas, and you can put your lecture slides in there for us, for example. So it's a nice way to essentially collaborate all of the different learning styles into one medium, which is really cool. So say you're reading a textbook or a hardcover book and you really need to retain all that information, or you're doing a licensing exam, for instance, you can make your own customized deck using this service or using Quizlet. Sometimes on Quizlet, if you just Google it, they actually have somebody else has already made that deck, which is really nice. So I've done that for a few things where I'll like Google, Quizlet blank, whatever, and somebody will have already made that deck. It's kind of fascinating. But if you have your own particular style that you need to do, or you're like, I want to actually type up my own cards, that's something you can totally do as well. And that's essentially in itself a pass that you're doing for the information also. I know for a lot of us, that's how we study as well, is actually making the flashcards on this the software. So it's definitely nice. It's free. So that's, a bonus. So this is kind of something that I don't utilize this as much as I should, but the cool thing about Anki is it shows you your statistics. So it shows you what you've been learning. It shows you your history. It tells you, hey, this is, what you've learned so far out of all of the cards available. And I like I said, I don't take advantage of this at all. Steph, do you use this at all?
No, it would probably terrify me.
Yeah, it kind of terrified me when I looked at this and I was like, okay, well, this is maybe my review deck, so I'm not sure. But I do know a few people that definitely look at it repeatedly so that they can kind of gauge how much they know, and by the time they get to the exam. I feel like for me, mental health wise, that just adds more stress. So that's kind of why I haven't looked at it, but I figured I would include images of it so you can kind of get an idea of how cool this software is. And another thing that's really cool is there are people out there that actually code for fun for this program. So they'll have add-ons that you can go find, and you can download them onto your computer, and it updates the software for you, so you have new features and new ways to interact with the program. So it's really cool. I mean, if you really need to learn a lot of information in a short period of time and retain that information for a long period of time, I highly recommend trying this or Quizlet, either of those. So there's that. And then, so this is sort of my general take home tips. So, you got to be flexible. There's no one right way to learn everything. Everybody learns differently. And for most of us, we learn in multiple ways. So the idea is to kind of see what styles work for you. And that's kind of what the second point is, be integrative. You probably have multiple dominant styles of learning, just like the three of us, all shared that, it's not just one thing. And particularly in med school, like just because it works in this block doesn't mean it's going to work in the next block or even the next exam. Sometimes, things change so quickly that, something that had been working all of a sudden is completely moot, and you have to go back to the drawing board and start all over again and see like, okay, well, what do I do now? So that's the third point is, be experimental. You won't know if it works unless you try it. And one thing that I think Steph can agree with is they don't really tell you how to learn in med school. They tell you how other people have learned, and they tell you what has worked, but nobody actually says this is how you're supposed to learn. It's really you're on your own, figure it out. If you can't, we're here to help you try to figure it out, but you're an adult. so we have to be experimental ourselves, and learning in itself is a trial and error. We're not born good students. You're not automatically an awesome student as soon as you start school. It's a skill that takes work, and it takes investment, and it takes practice. I've been going to school for a very long time, and I'm still working on my skills as a student. So it's an evolution. It's never going to be, I'm never going to feel like, yes, I'm a great student. I'm always going to feel like there's something else I need to improve here. And then the final point is spaced repetition. If you can see it over and over again, if you can quiz yourself over and over again, it forces you to remember something much longer term than if you were to just see it once and say, okay, I get it, because you may get it, but can you recall it? Can you explain it to somebody? Can you discuss it from a point where you know what you're talking about? So yeah, that's kind of the end of that. And then Steph, do you have anything to contribute to the take homes?
No, you did such an amazing job. The only thing I could even think of is the be flexible is huge, because as Tina said, I'm kind of in the same boat. I don't think I'm ever going to get to a point where I think to myself, I am the best student. I am so good at studenting. I think that there's always something to fix or change or tweak and see what works and what doesn't work. And the scary part is trying something new because the last thing you did didn't work. It's terrifying because you need to retain this information. So the idea is I need to find something effective quickly. But you really do need to try a little bit of everything to figure out what works for you. And I had the same frustration start school where I asked everyone in my vicinity, and Tina remembers this part of our training as well, how do you study? What do you do? What works? What doesn't work? And I wanted a solid answer. I wanted someone to tell me, this is exactly how you pass med school. And that's just not a thing. You have to figure out what works for you. And that's what everybody said to me. And by the end of the day, I was just like, blah, I don't want to hear that anymore. But it's very true. You have to try all of these things. And then you find that a certain combination works for you. And then you stick with that. And then you may find that learning something else requires a new combination and you have to start all over again. So the flexibility is huge. And I just want to say thank you for having me, because this was a fantastic presentation.
I agree, Tina. This was a fantastic presentation. I learned a lot from this. And one to say is I would like to apologize to my business coach, Ernesto, because yesterday he actually made the suggestion that I read the books that I've read more than once. And I was like, you're crazy. I'm not doing that. And now I realize that maybe that is exactly what I need to be doing, is reading this. Like you said, for long-term memory, like there are things that you naturally forget. So going over it more than once is beneficial.
Oh, I'm so glad that you're able to get a lot out of it. And thank you for having me and stuff. Thank you for joining last minute. I think you really like contributed a lot to the conversation, because I don't know if I would have been able to give as much context as you were able to. So I really appreciate you being part of it. So thank you so much.
Tina being modest again, but I'm very thankful to be here.
So just kind of a reference, these are sort of my sources. I don't know if there's any way to post this anywhere, but more or less this is where I got my information. So I'm going to go ahead and stop sharing. So yeah, that was in a nutshell what I learned as far as learning in med school. But thank you everyone for watching and for, feeling that what I had to say was valuable, for, listening to both Stefanie and I, talk about our experience so far. And if this has inspired anyone to pursue medicine, then all the better. I'm not sure if it has, but
I'm not sure that it has, Tina, but we definitely value you as a med student a lot more, because oh wow, like all the information you have to retain is amazing, which is why I thought you were perfect for a presentation like this, because I know that as a med student, yourself and Stefanie are retaining a lot of information, and that cannot be easy. You're teaching your brain basically to learn better, to learn more, to capture that information. And then you said, like, to remember it. It's not just about passing a test, it's actually retaining this information so that you remember it for a long period of time, and so that it helps you in the future. So that's impressive. I'm impressed with you ladies. My respect to you girls for everything that you're learning, and the amount of uh, information you're retaining, and how much you're pushing yourself to actually go through med school. Like, that's amazing. I'm inspired. Thank you, Tina, for making this presentation. I'm sure anybody that listens to it, like even in parts or in full, is going to benefit somehow, because some people don't know any of this information, and some of us know a little bit, and some of us have heard it before, but then we didn't retain that information, and now we're listening to it again, so it might stick this time. I hope that it helps somebody, and I believe in this case you already helped Stefanie and you helped me, so you are already winning, Tina. Thank you so much. I appreciate it. And thank you all. If you have any comments, if you have any information, if you have any questions for Tina, leave them in the comment section. She's going to come back and take a look at those if you do leave anything there for her. If you have any questions for Stefanie as well, we're going to make her come back and answer too. So thank you, ladies. Have a great night, and we'll see you all soon.
Thank you so much for having us.